friends, let's talk about misconceptions in COVID vaccines, or maybe your doubts about COVID vaccine. Okay, so I have multiple questions and I will be dividing this video into part 1, part 2 and blah blah blah, so that you get answers for all. And the questions go this way. So Pooja Naik asked me, hi doctor, first of all, thank you so much for sharing informative videos. Thank you, Pooja. And if you're seeing me, all those who are seeing me say, yes, I'm answered and I'm satisfied with the question answer. Okay. So she says, thanks me for informing the informative videos during pandemic, and she said, is it safe to take vaccine if person has some kind of skin allergy? So Pooja Naik, it is totally safe to take vaccine when you have some skin allergy, because the skin allergy may be of different type. The only allergy that you should be careful of is the content of the vaccine itself. That is the COVID vaccine. The content of that vaccine, if you have allergy to it, then only you have to be little bit careful. Otherwise, for any other allergy, you don't need to be. Second question is by Priyanka Naik. I hope you are listening. Hi doctor, I wanted to know if there is any side effect of vaccine on psoriasis patient, or is it safe to take the vaccine? There is nothing which is mentioned regarding effects of the vaccine on psoriasis in the vaccine pamphlet. Now what is vaccine pamphlet? There is something like a vaccine insert. That is a small paper which comes around the bottle in that box. Okay, so nothing is mentioned regarding psoriasis and vaccine. So please go ahead and take the vaccine. Third is Clarinda Dias. She asked me, thank you doctor for your help. Welcome. Should the gap of a month kept if I get vaccinated with COVID vaccine for my baby to be vaccinated with Penta-1 vaccine? God bless you. So Clarinda Dias, so your question is, if you get vaccinated, should you keep a gap of 1 month between your vaccine and your baby's vaccine? At the same time, you have said Penta-1 vaccine. So Penta-1 vaccine means your baby is 6 weeks old. Okay. So the recent guideline, which is advisory guideline, which is come on 4th of June 2021 of Government of Goa. Okay, State Family Welfare Bureau, Directorate of Health Services. This guideline was on 4th of June. So in this guideline, the point D, they have specifically mentioned that for women, ensure that there is no pregnancy, that is the lady should not be pregnant, and in case of breastfeeding mother, ensure that 45 days have passed since the time of delivery. Okay, so if your baby is someone who is around 45 days, so you can go ahead with your vaccination once you complete 45 days after your delivery, and there should be no problem of gap of days between your vaccine and the baby's vaccine. Absolutely no. Baby can be vaccinated on his or her due date. You can be vaccinated on your whichever is the date for the vaccine. So do not worry, no need of gap between your vaccine and the baby's vaccine date. Okay, so your COVID vaccine and the baby's regular vaccine. The next question is by Shweta S. Verlekar. Hi doctor, I have read in many articles online saying that you get blood clots after COVID vaccination. Not very soon, but as time passes. So I am scared to take the vaccine. Is it true? Thanks in advance. So Shweta, I hope you are listening to me. So see, the thing is, there was a CME on side effects in vaccination, and a renowned doctor who was speaking in that, I don't remember the name, but a renowned doctor who was speaking in that mentioned, and I have specifically written it here so that I can tell you, okay, that some of the side effects of the vaccine, as one is anaphylaxis, that is severe anaphylaxis, it is severe effect of the vaccine. The second thing is thrombosis. The thrombosis is your this thing, clotting that you are saying. Okay, now thrombosis, now see, when you get COVID directly, the COVID infection, there are 39 in 1 million chances of you getting blood clot. That is, if you take 1 million patients who have got COVID, 39 patients out of that can get clotting related to COVID infection. So remember the number 39. Okay. Now coming to a mRNA vaccine, this number goes down to 4 in 1 million, and coming to Covishield vaccine, this number goes down to 5 in 1 million. That is, if 1 million people have taken vaccine, then there is hardly any chance of 5 or 4 people getting this clotting. Very, very minimal. Every time whenever we give a medicine or we give any vaccine or any treatment is done for a patient, we have to always see pros and cons. What does that mean? Pros means what are the effects of the vaccine and the good effects of the vaccine, and cons means what are the bad effects of the vaccine or medicine or whatever. So these are the pros and the cons. If the pros, that is the advantages of if any action, maybe a medicine, maybe a vaccine, maybe a treatment, is more than the side effects of the vaccine or the side effects of the medicine or the side effects of the steps taken of the treatment, then we have to go ahead with the treatment. Okay, you cannot think that, oh, I may get clotting, there are chances of 4 in 1 million that I may get clotting after taking the vaccine, and take the chance of becoming COVID positive and get 39 in 1 million chances of getting the COVID-19 related blood clotting. I hope that makes it clear. So that means if you get COVID, there are higher chances of you getting clottings related effects, but there are very, very minimal chances after taking the vaccine. The next is Candida D'Souza. She says, does COVID vaccination affect fertility? Absolutely no. Candida, I have done an entire video on this, which is there on my YouTube handle, Dr. Poonam's vlog, fertility, COVID-19 and fertility related issues. Please do go through it. And for your question, does COVID vaccination affect fertility? Absolutely no. So as you're watching me, please see to it that you follow me on all these handles which I have written here. These are my social handles, Dr. Poonam's vlog on Instagram, Facebook page and YouTube, where you will get a loads of information about COVID as well as baby care, because I am basically a child specialist. So, but now just because I know that public requires a lot of answering for simple questions, that's why I am doing videos on COVID. Okay, so you will get a lot of information on COVID. Please do go through and spend your time in seeing these informative videos, and do tell your friends also to follow, so that we can spread this information. Next is Sunetra Mathur. She asked me which vaccine is better, as there are different brands of it. As of now, today, 5th of June, we have 2 vaccines which are right now available, Covishield and Covaxin. Now, what is the difference between the 2 vaccines? These 2 vaccines act in different way to make your body develop that fighting power, which is called the immunity. Okay, so our body starts developing immunity because of both the vaccines. The way they act on our body and develop the immunity is different. Okay, but finally we want the result. The result is that immunity, you are getting the immunity. Okay, now how much immunity you are getting is also depends upon your body's response to the vaccine. That is very important. It's not that vaccine is given and yes, I'm superhero, I have got the power. No, your body also has to react to the vaccine and develop or fight with the, we have a minimal fight within your body, so that you develop that immunity which can protect you. Okay, so Sunetra, that is your answer. Vanessa Oliver Fernandez, she has asked me what kind of mask should children use. So whether children or adults, we should use the similar type of mask, but children's mask should be their size. So the cloth mask can be something like these, which are small, plus with small cartoons and all that stuff, or something which is superhero, like which makes them feel, yes, this is my mask. Okay, at the same time, a surgical mask which looks something like this, and I have made an entire video on surgical dangerous mistakes that we make while wearing masks, which is on my, I think on my Instagram, on my Facebook as well as my YouTube channel. Okay, please go through it. And now while children are wearing masks, because these surgical masks usually come in a adult size. Okay, so what you are going to do is use this mask the way I have told in that video. Okay, so the softer part of the mask or the lighter color comes inside towards your nose, and the darker color and the rough part comes outside. So wear this mask, then you can turn this, when you wear this mask, you have to turn these sides. Okay, so turn these sides or tie these sides. Okay, so I will tie this side now. Okay, so that you know it, I'll tell you why we have to tie. So tie it this side and tie it this side now. Yes, so once you tie, okay, yes, this I have tied. Now this part you have to tuck inside. See, I have tucked it inside from both the sides, tuck it inside. And now these loops, you put them on your ears. Yes. Pull this down, and there is a metal plate here. Press it. Okay, this you have to do even in kids. Now you see there is a gap here, little bit of gap here, which is less than what it would have been if I was not to tie this. Then for kids, you are going to use the mask and put this on top of this, okay, and cover the mask. So now what does this top mask does? It helps in fitting the surgical mask properly on the face and decreases these gaps from where the air can go inside. So mask can be worn by children who are more than 2 years of age, okay, and above, and less than 2 years of age usually don't try to wear the mask, and they will not allow you to wear the mask. If they wear, fine, but better to avoid it. Above 2 years of age, use this mask and tell them that they have to use it. They have to fight against the virus, so they have to use the masks. Okay, this is very, very important. Then other things that you can use for children is teach them hand washing, teach them social distancing, don't take them out for social gatherings, and please avoid your 6-month birthday party, 1-year birthday party, 2 years, 5 years, 6 years. Please avoid it now. We have already had a problem of the second wave. We do not want to invite the third wave. Okay. So there are many more questions which are coming across to me, and you know there are many questions which are main so you know the pregnancy related, lactation related, delivery related, okay, and fertility related. Many are medicine related. So I have personally invited many other doctors who are from speciality, and I'll be making different videos on those questions. Okay, which will come in the next forthcoming days. So please see to it that you follow me on all my handles. Show me the support. Okay, tell me that whatever I am doing, is it helping you? And if you have any queries, whenever I write a post, please post a query regarding so and so topic. Please write it under that topic. It becomes easy for me. You know, I can just take a printout like this of all those questions, make one nice document, and it becomes easy for me to read instead of going on reading each and every comment, which becomes very difficult for me. Okay, so I request you to write under the post, specific post when I ask, okay, or you can just cut paste your problem from wherever and put it under my post so that I have a record of your question. However simple, however stupid, however baseless you feel your query is, please ask. We are experts sitting here to answer you, and we want to help you because we want a COVID-free world as soon as possible. Thank you.